I have the honor of introducing our commencement speaker, Dr. Kirsten Bibbins-Domingo. Dr. Bibbins-Domingo is the 17th editor-in-chief of JAMA, the Journal of American Medical Association. She's also the Lee Goldman Professor of Medicine at UC San Francisco. She previously served as the chair of Epidemiology and Biostatistics at UCSF and as the inaugural Vice Dean for Population Health and Health Equity. She co-founded the UCSF Center for Vulnerable Populations at the Zuckerberg San Francisco Journal that focuses on actionable research to improve health equity and reduce health disparities. Dr. Bibbins-Domingo has received numerous honors, including induction into the American Society for Clinical Investigation, the National Academy of Medicine, and the American Academy of Arts and Sciences. She was recently named by Modern Healthcare as one of 100 most influential people in healthcare. In a recent editorial in JAMA, she wrote that it is paramount that the voices in the room where decisions are made represent the diversity of thought, expertise, and backgrounds. The voices of those historically marginalized and excluded from science and medicine have also largely been absent in scientific and medical publishing to the detriment of all. Please join me in welcoming Dr. Bibbins-Domingo to the podium.
So it is quite an honor and privilege to be here with all of you today. I'm particularly moved to have been invited to speak by the leadership of the Berkeley School of Public Health. This is a wonderful institution where so many of my friends, colleagues, mentors, mentees, collaborators call home. My brother and my sister-in-law are graduates from the MPH program. And the ties between UCSF, where I'm a professor, and UC Berkeley in the area of population health are particularly strong, and they reinforce the commitment to public health in the Bay Area and in California. I'm sort of emotional here today, too, because I've attended a few graduations here at the Greek Theater. My son is a two-time graduate from the Haas School of Business, and so I know this venue so well. So I know some of the things that you all who are in the stands are feeling today. I know that fear you have that the weather won't hold up and it's going to get cold as the ceremony runs long. I know some of the pain you're feeling on those cold stone seats up in the... But I also know the pride you have in the graduates that you're here to support today, and who you are celebrating with them as they commence in their life in public health. So today I want to speak to the graduates. As you sit here, you are happy, exhausted, nervous, excited for what lies ahead. And what I want you to do is think about that emotion that brought you to public health to begin with. Usually what motivates us to choose fields like public health is the mission. It's usually not the salary. And during the pandemic, we realized we couldn't even count on the public's affection and reverence for the field of public health. So you're entering this field at a time when really what should motivate you, and what I suspect has motivated you, is the mission. We choose this field because we want to improve population health. We want to improve it particularly for those most in need. We are motivated oftentimes because of something very specific, that thing that really gnaws at us. For some of us, it's because we're intensely curious about something in health, and we want to know more about that particular thing. Sometimes we're motivated because we're intensely frustrated about something that is a barrier to health that's existed for so long, and we're motivated to make that change. Sometimes we're motivated because of fury, because of anger at the injustices that we see that perpetuate some of the poor health that we see, and the belief and the knowledge that this could all be different. And sometimes we're motivated just simply because of the things that delight us, the things that we see better for the future. Ultimately, we're motivated by a sense that the world can be better, and the belief that we can work together to bring about that change. So we're drawn here by the mission and by our individual passions, and we take those passions for public health. We use them to complete the rigorous training that you've done here at Berkeley, and we're going to use it to go on into the world to take those jobs and work that will fill our future. The day-to-day of the work that we choose is usually about those aspects of public health that speak most to our skills and our inclinations. For me, I've always been a scientist. I've always been one who wanted to understand how the world worked. I always wanted to understand how we could use that understanding to think about something new that might be better for the future, and how to test those things to see if they actually work the way we think they're going to. So while it's passion that drew me to public health, the day-to-day work of a scientist is about careful, detailed, objective, meticulous work. It is dispassionate work. It is easily very disconnected from those passions that brought us here today. And because it's easy to feel disconnected, it's important to figure out how you can tap back into that thing that drew you to public health to begin with. The disconnect is particularly true for the scientist, but I would argue that it's true for many of you as you go to think about the day-to-day work that you will do. You have worked hard and completed a very rigorous program here at Berkeley because you've kept your head down, because you've worked really hard through all of the coursework and all of the requirements. And as you go on to the work that you'll do, you'll also keep your head down. You'll stay focused, and you'll do that work exceptionally well. But at some point, you're going to wake up and say, but how does this all relate to the thing that brought me here to public health to begin with? How does this going to be the change that I wanted to see in the world? How does that relate to the day-to-day that I have to do? So I've been fortunate to have those around me who have helped me through these times. The people who've helped me stay focused and keep my head down so I do the work well day to day. But the people who also tell me to lift my head up and to lift my eyes up and to see where we are going. And to remember the change that we are all working so hard for. So I have a colleague who has a very simple analogy that I hold dear. She says, scientists make the stones, and then they give them to the advocates to throw. So I love this analogy because I see myself as a stone maker. I'm always chiseling away at the stone to uncover some new insight to further the science of public health. But the analogy reminds me that the work I do on its own doesn't bring about the change that we seek. This only happens when we work together with others, with the advocates, the stone throwers, the people who are working closer at the interface of change. Some of these people are in communities, some are in the government, some are other people you are graduating with here today. It reminds me that the change we seek only occurs in partnership with people with different skill sets, different ways of seeing the world, sometimes distinctly different. I hope there's some of you in the audience who will be scientists, who are destined to join research teams or even lead research teams, generating the evidence, contributing to the science of public health. And I hope this analogy resonates for you, to remind you to make great stones, but also to work actively to give your stones to others, to communicate your science to others who can use what you find to bring about the change you seek. I also hope that there are stone throwers in the room as well. God, I really hope they're stone throwers. Yes, I'm hearing some now. Awesome. We need the stone throwers because, as you know, some of the most intractable issues we face in public health are deeply rooted in inequality, in injustice, in racism and oppression. And we need the stone throwers who are impatient to bring about the change that's so crucial to improving health. And so hopefully you stone throwers are out there and that you find some of the stones that those of us who are chiseling away are trying to create. Hopefully you'll find some stones that are particularly hefty ones, or maybe even jagged stones that are more effective in your work when you're throwing. Now, I'm guessing there's some of you who are not quite stone throwers and not quite stone makers, and you don't see yourself in this analogy, but I'm going to tweak it a little bit to hopefully give you something as well. The analogy works this way as well. Scientists make the stones, and they give them to the builders to build. So some of you are builders. You will take what emerges from the science, and you will build it in a way to more effectively bring about the health that we all seek. You might even work with the advocates who are breaking down the walls, and those of you who are builders will pick up some of those pieces that are left, the best stones, and build back up for a brighter future. Whether you are a stone maker, a builder, or a stone thrower, the point is that we need to work together to bring about the change that we seek to advance the health of the public. The wonderful thing about great institutions like UC Berkeley is they're designed to help you build the skills regardless of which path you choose. Great institutions like UC Berkeley are designed to help you in the skills you need to be a better scientist, to help teach you the skills of advocacy, to help you to be a more effective builder. The other great thing about schools like UC Berkeley is that your deans have been willing to indulge me in this analogy. And so under your chair today, you'll find a small stone, one for each of you graduates. This little small stone, oh yeah. Nice. So this small stone is a gift from your deans. I urge you to look at this stone. I urge you to look at this stone and think about how you will use this stone. Is this stone, are you somebody who looks at this stone and thinks about how you could unlock the thing that sits inside of it, chisel away to find some kernel of truth, some evidence that will help you gain new insights about public health? Is this stone a weapon for you? Do you see it as a way to help fight injustice? Or is this stone something that you see that together with other stones you could build to help create a better future? The great thing about the education you've received here at Berkeley is that you have the skills to make the stone be what you want it to be. Your job is to figure out how you will use this stone best. All of us have the capacity to use this stone in any number of these ways, and we might even use the stone differently at different points in our career. But the reality is that the way we spend most of our day-to-day lives is in one primary role. And the key is to remember that to bring about the change that we seek, the mission for improving health requires that we work together. Stone maker, stone thrower, and builder. I salute you, Berkeley School of Public Health class of 2023. I congratulate you and your parents and supporters who will walk this journey with you. I look forward to being part of the change you will bring about in this world, and I will be cheering you on. We need you.